Big story today. The World Health Organization declaring an international emergency over the explosive spread of the mosquito-borne Zika virus.
Some estimates predict as many as 4 million new cases in the Western Hemisphere this year alone. Our health specialist Christy Kruger is in the newsroom with this one for us.
Yeah, these numbers are really staggering. What the World Health Organization did today is rare. The last time it declared an international health emergency, we were talking about Ebola. The action, though, extremely important because it not only signals the seriousness of this outbreak, but it also gives countries powerful new tools and money to fight the Zika virus. In Brazil, a frightening wake-up call. Soldiers going door to door, warning families about the dangerous Zika virus. While in Switzerland, the World Health Organization holding an emergency meeting, declaring the Zika virus and its suspected link to birth defects a public health emergency.
After a review of the evidence, the committee advised that the clusters of microcephaly and other neurological complications constitute an extraordinary event and a public health threat to other parts of the world. In their view, a coordinated international response is needed to minimize the threat in affected countries and reduce the risk of further international spread.
The Zika virus is transmitted by mosquitoes and seems to be especially devastating to women affected in their first trimester of pregnancy. This emergency designation will trigger stronger action and funding from governments and nonprofits around the world. Since there is no vaccine to protect people from the mosquito-borne illness, the World Health Organization is once again warning pregnant women, or even those planning to become pregnant, not to travel to countries in Latin America or the Caribbean where the Zika virus has been found.
The experts agree that a causal relationship between the Zika infection during pregnancy and microcephaly is strongly suspected, though not yet scientifically proven.
All right, so a couple more really important notes here. The Zika virus has been diagnosed in the U.S., but only in people who had recently traveled to Latin America or the Caribbean. And we do, by the way, have that very same type of mosquito here in the U.S. There are a number of different types of mosquitoes. This one could carry potentially the Zika virus, but that's why efforts have really been stepped up with mosquito control. And researchers at the University of Miami are working on even better ways now to kill these insects where they sleep and where they breed. Lori?